conventional physical therapy is really important, and using the ultrasound, the electrical stim, the passive stretching, mobilization techniques are all very, very important. But what I've discovered is that standard physical therapy has a limited impact on this type of adhesion because, well, for one, ultrasound usually penetrates too deep. It doesn't get at the level of where we want to be at. And electrical stimulation is basically trying to increase the circulation and create relaxation in the tissue. But that is only oftentimes very temporary as well, especially if there's a lot of adhesion formation. With traditional stretching exercises, you really have a limited impact on stretching an actual adhesion that's of any density in the tissue. If it's if it's just forming, you can probably have some success at stretching it out. But once it develops density to the adhesion, it's much more difficult to stretch out, and everything stretches around it as opposed to really isolating and stretching that adhesion. These modalities, they've been used quite extensively. But because the adhesions have developed, these tissues, they're in a whole different state. They're all congested, they're all glued together, their circulation is impaired, their nerves are being irritated because they have lack of circulation. So we need something to actually break that loose and free that up. With the Mettler release technique, we're able to very specifically identify where these hidden adhesions exist. And we're able to put the right amount of tension on, torque the tissue, and free the adhesion almost instantaneously. And we may have to work through different layers to get through the entire adhesion, but what we release will stay released for the most part as long as there's no ongoing inflammation. And that's why we try to identify what it is that created that problem in the first place. We want to release the tissue, free the tissue, show them exercises to get their strength back, correct their biomechanical deficiencies, and give them the ability to enjoy life to the fullest. Without this important adjunct, patients end up not getting as much improvement as they had hoped for, or they end up getting re-injured.